Night, Sunday night, cold for Valentine's. I'm Scott Laurie. More at the Weather Channel on News Talk 760 WJR.
iHeartRadio, the WJR app, WJR.com. However you like to listen, WJR is there. Oh, and we're on your radio too.
Good evening, everyone. I'm Anne-Marie Cronin, and I'll be hosting a special live broadcast tonight on News Talk 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is here tonight to tell you what you need to know about how to avoid heart attack and stroke altogether, and what you need to do to prevent Alzheimer's and many other chronic diseases. If you have a question, we're opening up the lines and taking your calls, so please make a note of this number, 800-859-0957. Again, that's 800-859-0957. We'll be repeating it throughout the show, and this is your chance to talk to the doctor directly. So stay tuned, and we'll be right back. You're listening to News Talk 760 WJR. Are we on Facebook Live?
Yes, we are.
So what are we going to be talking about tonight?
We're going to talk about how much time was taken off the show bleeping my words.
Well, I got the list of the words that you're not allowed to say, so I think we're okay, because most of our words you'd think about using anyway, so
Except one.
except one. But
So
I don't know how one got through, but anyway.
I'll do my best to behave,
Right.
although I don't see why.
Well,
it's-
because you don't want to be bleeped right off the air because
Right.
your program's too important. So
Well, it was fun. So, well, I was angry last week, and we should be angry every
Well,
week
you're angry every week,
because
yeah.
it's an abomination, our healthcare system, that no one is standing up for your rights except me, Anne Marie, although if the Queen said get it, then she'd get it.
oh yeah, no doubt about it. Absolutely. Somebody has to be in charge. The problem here is no one's in charge.
Agree. There's no leadership here.
There's none.
No
And that's
leadership.
the problem. So you've got all these factions out there, and to the left and to the right and to the middle and to center, and the bikers and the truckers, and they're all over the map, and they don't know what the hell they're talking about.
Well, they know how they feel, and they feel like they've been misrepresented and they're not being taken care of, and that's from not having any leadership. Again, I mean, we talk about that a little bit, lack of leadership, but I don't know how
We
to.
do have a caller, though.
Oh,
You got
already.
a caller
Yvette.
already?
Yvette.
What? What's the name?
Eveette. Yvette.
Yvette. Okay.
What city is
Again,
she
I'd
from?
like to welcome all of you to a special medical radio show here on News Talk 760 WJR. I'm Anne-Marie Cronin, and we are here tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, your shows are always interesting and informative. We're always lucky to have you here. Olivia's telling me she's got a caller. Do you want to take the call?
Sure.
Olivia?
We have Yvette from Detroit on the line. Yvette, what's your question?
Yes, I have a friend that has high blood pressure, and they don't live here. They live in another state in Florida, and they don't get your show there. So I'm calling in for her. She takes the generic form of X-Forge, and she is on a clonidine transdermal system. That's that patch, and she has to change it every 5 days. And she also has a problem with her cholesterol. And she would like to know, are there any natural supplements that she can take to control this her cholesterol, so she won't have to be on medication for that as well.
Well, thanks for calling, Yvette. And I would ask a different question, which is what else is going on that's driving the cholesterol? Not so much of how do I, and your blood pressure, how do I identify other drivers of disease? So, someone who has multiple medications for high blood pressure, you really have to think about undiagnosed sleep apnea as a cause. And also, your friend in Florida needs to identify their disease. Do they have plaque? What's the degree, not in terms of stenosis, but inflammation? Get lab work that measures artery health, and then move forward from there, because she may have other silent drivers of disease. Like, for instance, Sunday, we're going to do a whole show about insulin resistance, and your friend may have undiagnosed insulin resistance, which needs to be addressed to keep her alive. So that's where I would start, is look for sleep apnea.
All right, Yvette, thank you so much for calling and taking care of your friend. Dr. Kolender, obviously we pre-recorded the Sunday show, which is all about insulin resistance, and I hope everybody listening tonight will tune in Sunday at 3 p.m. to listen to it. Very informative. And it's all about early diagnosis and all about finding out what insulin resistance is, who gets it, how we treat it, what you do if you're diagnosed with it, and how dangerous it is to even be in that realm of having insulin resistance. So let's continue on tonight, Dr. Collender. I just feel sorry for the patients that are out there. We have all these calls. These people seem to be lost with not having the right or good enough or adequate shepherding by their doctor. Why does the patient always have to be their own advocate, their own diagnostician? Look at your own test results. Make sure you get this test, that test. That's what doctors are being paid to do. What's wrong with us?
Because they're crap. Our healthcare system's total garbage, and no one's thinking. They're just following the recipe, the the boxes that they need to check. X-Forge, what this lady's on, is like 3 drugs. So she's on 4 blood pressure pills, and no one thinks, hey, maybe there's another condition I ought to look at. No, just take another pill, take another drug.
No, this is a massive problem in this country, and I'm wondering how did we get to this stage? Why is it that people are walking around with bags of medications? They go to the doctor, they come out with another pill, another prescription, another medication.
I'll tell you exactly why. Because when you're in a population medicine system, which
But
we're
this is a
in,
population. This is the entire
right?
country.
Well, this is why. It's because we are under systems of control, and the control is to guide the doctor into prescribing drugs. When you don't have any time to spend somebody, what do? You write a drug, or you refer to a specialist who orders more testing and does surgery. Repeat. And so when you only get 5 or 6 minutes, oh, this person has a cholesterol issue, they got a blood pressure problem. Well, here's another pill, here's a cholesterol drug, see you in 3 months. Oh, you have another complaint, go see a specialist. You see a specialist to get testing, all done at the hospital, of course, which has a giant lobby for all these things to happen. It's all about control. And I want to kind of show how that this is a great mirror against COVID, which is about control. It's no early treatment, no early diagnosis. So in COVID, there's no early treatment, and in prevention, you need early diagnoses, screening. It doesn't happen in prevention. It's not happening in COVID. It's the same thing, same process of move everything to a pharmaceutical product, move everything into the hospital. And that's how our system is. And until somebody stands up for us, like, we're trying to do, and hopefully we don't get bleeped, but somebody stands up for us so that we can change our system for the better.
The system in America as it stands today is woefully inadequate, and it's like such a huge mountain to climb over that I'm not really sure how we go about doing it. But I guess we have to start with patients realizing that somehow they're being shortchanged or shafted with what they're getting when they're when they come down with or they get diagnosed, they're being shafted. Anyway, we're going to have to take a quick break and we'll come back and talk about this on the other side of the break with Dr. Brian Kolender, MD. He's a specialist in prevention, and if you have a specific question and you'd like to talk to the doctor directly about what you need to do to prevent catastrophic disease, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
Yeah.
Such a mess. No, I mean, it's not even
it is a
funny. I
mess.
mean, it's like, it's overwhelming. It's like every single person that calls in, they have a doctor, they go to see a doctor, and it's like
And I
they're
guarantee
bouncing around and getting nowhere, and they don't realize that they're getting
I
nowhere.
guarantee you that lady's blood pressure is not controlled.
Probably.
It's not controlled, and she's on, 3-in-1 drug and then a very strong other drug that's a patch, and it's all for nothing. It's all for nothing. You've got to identify the process, which is inflammation via the CIMT, using lab markers to measure activity, and then apply a program and identify all the other drivers. So, because the boxes to check are, is your LDL low and how's the blood pressure? Those are boxes. If you're diabetic, what's the A1C? Those are not numbers that mean you're okay. And the system's just, it's awful. It's just awful here. And it's again, thankfully we're kind of in a COVID lull. I don't know. I want to keep coming back to it. But we're in a COVID lull.
You've been practicing for a long time and you were in the system for 20 years. Was it this bad 20 years ago, 15 years ago, 10 years ago? Was it always bad?
No, because I left before the real population hit, the real population drive hit. So that's the patient-centered medical home process. So when I saw that coming, I left.
I thought there was something corrupt about that. I thought there was something really scary about that whole process.
It is
And
corrupt.
but you know what? I'm really surprised that doctors bought into it. I
'Cause
kept
doctors
thinking,
are sheep.
no, but okay, fine and dandy, they're sheep, and none of them really like the insurance companies anyway. I'm just not sure where the major medical insurance company here can walk into a primary care doctor's office and say, convert over to this system, which was very, not a good plan at all for the patient as far as the patient's concerned. So I'm just wondering what was in it for everybody. What was in it for the patient? What was in it
They
for...
didn't have a choice. It was marketed as a benefit to the doctors. Well, here we go.
What was the benefit?
They got a little extra money.
Kind of dangerous though when you think about it, if you don't refer people up to a specialist and you can't take care of it yourself. If you're just now joining us, I'd like to let you know we're welcoming you to a special medical radio show on News Talk 760 WJR. We are back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. After 20 years in practice and watching patients die prematurely and unnecessarily, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke. We're inviting listeners to call in with your questions at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, over the break, we were talking on Facebook Live about what's wrong. How did we get to this state? You were 20 years in a traditional internal medicine practice. You then converted 5 or 6 years ago to a prevention specialist private practice. I mean, what went wrong, and how is the? I mean, I'm more worried about the patient out there because they're completely lost. We're getting calls from all over the country. Everybody seems to be lost. The last call was from Florida.
The patients don't have anywhere to go because their doctors have locked themselves into a system that gives them no room for freedom, and they are stuck doing the standard process, the standard protocol for every single person, no matter what they are, who they are, what diseases they have. It's the same boxes that need to be checked. And people are dying. They're literally dying. This isn't a question of access. It's not a question of, oh, I can't get to see my doctor, inconvenience. It's not a question of costs. This is life or death. Every year, the same number of people in the United States die from a heart attack or stroke. And in my mind, these are 100% preventable. So it's criminal. It's not even just like, oh, the system's bad, boo-hoo. This is, people are dying that do not need to die. And we're in a wealthy country with resources.
Right. And not only that you're in a wealthy country with resources, but you have the technology that's available. It's out there. None of the technology is covered by insurance. And also, most patients don't even know that it's even out there.
It's simple, stupid. I hate to say it.
No, I agree. But how's the average listener to know about it? Olivia, you have a caller?
Yes, we have Katie from Birmingham. Katie, what is your question?
Well, my question is, shouldn't some of the responsibility for a person's health and what's manageable by the healthcare system on them? I mean, we have a lot of people out here that are now beginning to accept being overweight as, a disability perhaps, and excusing that they need to, get fit, get shape, eat the right foods, take care of themselves. You can't always put everything on the medical system. I'm not saying there aren't problems with it, but for crying out loud, how can someone be obese and suddenly be excused for that? I know that the doctor has heard this talk going on and heard this new acceptance is supposed to be pushed, and I don't agree with any of that. I think people need to be more responsible with their health. They're not following doctors' directions. They're not following the diet plans that they're given in order to prevent the problems with heart disease and high cholesterol and all those things. Why should we sit here and malign the healthcare system?
Because
I'm going to fight you for the answer here. Go ahead.
You can go.
Okay, so coming from another country where our healthcare system was 100% better than it is here, there's many failures here. And the doctors are not prescribing the tests that people need to know about in order to prevent the disease that eventually will be disastrous, whether it's cardiac disease or whether it's cancer. These diseases are all preventable due to the fact that this is a very wealthy country. You need to wake up and smell the coffee. I'm sorry, it exists here. You've got the money, you've got the wherewithal, you've got the technology. You even have doctors like Dr. Kolender who are into prevention. So you know what? Diet and exercise is not the answer. What the answer is knowing what's out there, knowing what's available, and knowing how to get into a system of prevention. Dr. Kolender.
Yeah, and it's nothing to do about weight and obesity. It has to do with disease identification. There's plenty of people who do what they think are the right thing. They're eating right, they're exercising, they still drop dead of a heart attack.
Dead, yeah.
They still have a
600,000
stroke.
a year.
And so this is about identifying the individual profile and putting them on the right program for themselves. People do not know what to do. And it might seem obvious to you, Katie, and good for you. Do not assume that you're healthy because you're exercising and working out and you might feel good. You have no idea what your health is unless you get a full evaluation where you look at your arteries, you look at your IMT thickness, you get inflammation markers. You cannot make assumptions. And I've got plenty of patients that are obese and their arteries are healed. And I've got plenty of patients who are, frankly, look like Tom Brady and they're in a wreck. So it does not matter what you look like or what shape you're in. You need to know where you are and address your personal weaknesses, which may have nothing to do with your body shape.
And more than that, it's egregious that these tests exist. Some of them have been out there for a long time. The CT cardiac calcium scoring test has been out for 20 years, still not covered by insurance, and probably half the listeners don't even know what it is. The CIMT, they don't know what it is. The diagnostic tests that are available with the technology they have in this country is not being talked about. The doctors aren't suggesting it. It's not being prescribed. And so I feel ultimately sorry for the American public that they're stuck with what are they supposed to do, because they are lost. Not everybody can find you or find the half a dozen How many prevention specialists are there in Michigan? Half a dozen, 2, 3, 4? And
Not
it's all
many.
about, no, it's all about preventing disease.
Right. And so
And the
it,
tests exist. And what is the excuse? Why is it that we're not covering these tests?
well, according to Katie, it's everyone's job to make themselves healthy and make their own food choices. They don't know. People just don't know. The job is up to the doctors to
Exactly.
choose to take better care of people. This, and I will agree with Katie on this, that the system doesn't matter. It's up to the doctors to leave the system so they can provide better care. Right now, we're relying on Canadian truckers to stand up for us and tell the world, that we should be demanding better care for ourselves, whatever part of the, North America we're in. And no one else is standing up for us in this country, making a stand, except you and I.
No, you're absolutely right. And I think
Everybody
it's,
else has been canceled.
no, but
Sorry.
I mean, I just think it's absolutely ridiculous because you have the technology in this country and you're able to diagnose these diseases early on. And your specialty of prevention is jump on the bandwagon, get diagnosed. We did a Sunday show that'll air on Sunday at 3 o'clock. It was pre-recorded. It's all about insulin resistance. People don't know they have it. How do they find out they have it? Why aren't doctors doing the necessary testing to let the patients know they have insulin resistance? And insulin resistance is connected to how many diseases?
All the things you don't want to have that ruin your life. And so, again, you can't make assumptions about anything. You need to have your health evaluated so that you can be put on the right path. And it's not so simple, yet it is. It's not just eat better and exercise more. That's white noise to everybody. People need to understand what's going on with their arteries. And then when they're shown the right data, that's impactful and people change. And I see that in my practice all the time. The right information gets the right results, and it has to be delivered by someone who understands it. And that's not going to happen in your 5-minute office visit.
And something's wrong with this picture that you've had this technology for a long time, and all the tests that belong to your practice of prevention, all those diagnostic tests, no one knows anything about them.
The system is not designed to keep you from having disease. The system wants you to be sick. They want you in the hospital. They want you having surgeries. They want you on drugs. That's how our whole healthcare system is. And so, no, it's not built that way. It needs to be broken down and rebuilt. And until that happens, you're all on your own, finding
End
what you
care
need.
disease is a big money maker, and it's all about money. All right, let's come back and talk about this some more on the other side of the break. Again, you're listening to a special live medical broadcast. If you have a specific question and like to talk to the doctor directly about what you ought to do to avoid heart attack and stroke, or have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
Why is everybody, I was apologizing for the doctors, and, I'm over it. Everyone's
How
apologizing
can
for
anybody,
the
I mean,
system.
how can, what did she live in Birmingham?
Yes.
I mean,
She's either a nurse,
no,
that was a personal affront to her. So she's either like a nurse or married to a doctor.
Hmm.
no,
You know,
but
that
I
was
mean,
she was personally involved in that
you
conversation.
really think that everybody out there is smart enough to figure, and it doesn't even work, okay? So if you're healthy and you eat well and you exercise every day, doesn't stop you from getting any of the above diseases. You got 2 callers?
Yeah, we have David and John.
From where?
David is from Windsor, and then John is
Oh
from
my God, David calls every week. Yeah.
but John is from Detroit, but he's currently in Windsor.
Okay, so do you want to take David again?
Of course.
Okay, we just tell him thanks for calling again. But I mean, I don't know. I mean, she was just way out of line. I mean, that's like I wanted to cut her off because it's such bad information. Like, oh, you can be well if you just exercise and eat well.
Right. Not true. You got to know. You got to take every person where they are and then improve them from there.
I just wasn't nasty enough.
Well, let's get nasty.
No, but I mean,
Now we
now you have three callers. Who's
Tom
the third
from
one?
Toledo.
Toledo. There we go. Okay, Dave, we're limiting you to 2 minutes every week.
He's quick.
He is.
He gets to the point.
Yeah.
He does.
Don't knock
Am I
Dave.
segment 4?
Yeah.
At least he's admitting he's from Windsor now.
Right.
The T-shirt is what we need to get you.
What's
Right.
that? A heart?
A heart
The
T.
I
Yeah, we
Love
do.
Dave T-shirt.
Right. I love Dave. Oh my God, that's too funny.
Right.
He's a supporter.
Yeah, but right. I
Yeah.
mean, he calls every
Listen.
week. Yeah, that's really true. We should not be acting as though we're not on Facebook, but no, but he does call every
You know,
week, and he is intelligent.
Can you shorten your lead-in segments and get
Can
right
next
to
week?
it?
Yes,
Yeah,
I can
'cause it just-
solidly do that. All right. In fact, I can probably do it right now because I got the go ahead from Marcel.
Especially when we have, you don't have Rick telling you what
Now we
to
have
do.
4.
Oh, never
Yeah.
mind. Tom dropped, so
Well, he
Tom
might
drop.
come
We're
only
back
have
to
two.
3.
He might come back.
Oh my gosh,
Yeah, I guess we're not entertaining on Facebook right now
we're not.
because
We
we're not
did-
talking.
Well,
we did
okay.
have one comment. It wasn't a question. It was just a statement.
What was
What?
it?
PCOS makes it hard to lose weight. Makes it near impossible to lose weight.
Who's that from?
Danielle.
Well, we don't disagree. But
What's
but
PCOS?
polycystic ovarian syndrome, that's the
Yeah.
question you asked me about on text from the show. You said they asked a person to call. So, PCOS is a complicated problem, and I'm still going to say weight in my mind is not a data point that matters.
Mm-hmm.
I don't think weight matters. I just don't. I
No,
think if
because
you-
look at the blonde bombshell.
people want to lose weight, but it's not a prerequisite to being healthy.
Mm-hmm.
You
You're
can-
right.
It just isn't.
Well, that's not the answer to everything. That's what was so juvenile
Right.
about this. All right. Seconds. Welcome back to our special live medical broadcast on News Talk 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention. And we're ready to take your calls at 800-859-0957 if you want to talk to the doctor directly. We do have a lot of callers coming in, so we're going to cut this short and go directly to the doctor. So, Dr. Kolender, how many calls do we have here waiting?
We have 2 calls waiting.
Okay, who's calling? Olivia.
The first call we have David from Windsor. David, what is your question?
Yes, the question that I would like to pose to the doctor is this. Do you find that many doctors that are in the system are leaving the system and going into private practice as a result of being dictated to by the governments and everything else? Do you find that happening in a lot of areas where doctors are going into private practice?
Actually, Dave, and thanks for calling. I do not.
Yeah, I don't
In
think they're
this
leaving at
area,
all.
it's not happening.
Right.
Doctors are horrified. They're terrified to leave the system because they don't know any different. And having done it, I want to say it is scary. And because you're leaving a job that you're familiar with and starting a job that you're not, and hoping that people come with you. So at the end of the process, it's great. It's the best way to practice, and there's tremendous job satisfaction. But it is not something that doctors are doing in this area at all.
Yeah, it would be nice if they would, but Dave, thanks for calling. Olivia, you have another caller?
Yes, we have John from Detroit who is currently in Windsor. John, what is your question?
Hi, hello. This is a great show. I'm a trucker. I listen a lot, and I'm over in Windsor. I'm on the 401 right now. I have a load going to Windsor, but I don't have to cross over the border to go through the stuff that's going on. But I have a medical question. My wife, for the last couple of years, has had abdominal pains and pains, you name it, and she's had every test done. Last time they did a blood test, they checked for celiac and IgG, and nobody's finding anything wrong with her. And I'm telling you, if you could imagine a movie where the drug addicts are laying on the floor in the corner because they need their drugs and they're cramping up, sometimes that's how my wife looks, and they can't find anything wrong with her. What do you suggest?
Well, thanks for calling. And thanks for holding up the line over there on driving in Canada. The first thing I would always ask all my patients is what are they doing for food when they have a gastrointestinal problem? And a lot of times the wrong foods generate inflammation. So she should be on a very restrictive, high fiber, vegetable only diet for a while, and to work on those things. But again, we're assuming you've ruled out everything else. You've ruled out, liver, stomach, pancreas problems. You're assuming all that stuff is taken care of. You need to make sure it's not a vascular problem, because sometimes vascular disease presents as stomach pain. You're eating, you're drawing blood into the gut, and there's a blockage, and it causes pain. So you want to make sure this isn't a vascular issue. There's just so many areas to cover that I don't know that it's been done. So,
So, Dr. Kolender, what kind of test does this patient need to get? Because obviously she's in a lot of distress. Her husband's calling. They're not getting anywhere with whatever tests they've had done. But what are
well,
the specific? What should he do next for her?
I
What
mean,
should she do?
this is a problem with a lot of possibilities, and that I just don't know. I'd have to review the chart and look at the lab testing and the blood work, and then before I could even talk about it. But a lot of people respond to avoiding inflammatory foods. But again, when the typical things have been ruled out, you've got to really think about some other strange things, and they're usually inflammatory in nature. We could probably spend a whole show on her problem.
Right.
It sounds like a great challenge, not to her, because she wants to be healthy, but it sounds like a challenge.
All right. Well, thanks for calling and good luck with your wife's situation. And also, for further information, you can call 866 Kolender if you'd like to follow up and get some more advice. Dr. Collender, I just feel really sorry for these people that are out there, because obviously, we know that the healthcare system is falling short. But when you hear these stories and these callers that are talking about, my wife's on the floor and she's going to see a doctor and she's getting tests, what's wrong with this picture?
Well, there's a whole other problem in Canada. They do have socialized medicine, and, unless you're at the top of the list, you might wait months between getting a test. So, yeah, it's covered and you have access, but some things are limited. And, people have died there waiting for a surgery after having a test. So it sounds like it's a great thing as long as you're healthy. But sometimes if you're having a problem, that system fails people because there isn't enough access. In this country, we have great access if you have a problem, but there's no process in place to stop you from having a problem. United States is phenomenal at treating bad issues. And that might be one of the answers we give this person is, John, is bring her over, and get a workup in an American hospital where things happen a little faster.
Well, coming back to that, let's also not forget that all of the tests that are involved in prevention are not being offered, not being discussed, not being put out there by any of the doctors other than you. So,
Well,
it's not necessarily that she's going to get diagnosed any quicker, any better, any faster
well,
here.
this isn't a prevention issue. This is I've got a problem and we need an answer, and it's not necessarily prevention. We're being very speculative to say, hey, what was going on 5 years ago that may have given someone an indication that there was a chronic process that could have been aborted early on. We're just speculating. I do not know, but there was always some opportunity in retrospect where we said, hey, we could have made some changes here and stopped some inflammatory condition from getting to this severe place. Because when it's severe, it is hard to fix because you want to fix right now.
Hmm.
And some of these changes of healing take time. Like healing our arteries, it's 100% possible, but it's not something that happens in a month or 2 months. It takes years to heal your arteries. You're 50 years old. This is, 45 years of work. It's not going to turn around and quiet down in a month or two. It takes, months and months. I don't do these CIMT tests more than once a year. It takes that long, to see changes occur. But we do see changes for the better all the time.
But again, coming back to that, half the country doesn't know what the CIMT is, and
Half.
or more than that, right? Exactly. And they're not aware of what that's the problem here in this country is you have the technology, but nobody knows about it. So
Well,
why are you better off here than in Canada? I don't get that.
it depends. If you have a problem, then you're on a queue in Canada to get treated and evaluated, and you're sick. Here, you'd have a problem, you go to the hospital and they'll work you up until it's over. You get admitted and you're done. When you're sick, there's all kinds of access. There just isn't a plan to keep you from getting sick. The United States is great at treating sick things, and problems and end-stage disease. It's a great place for that, but it's not a great place to not have a problem, to avoid it.
Yeah, but that's sad because you have the technology and you have the capability to have everybody avoid these devastating and chronic diseases.
It's terrible because, like we said, it's killing people. And this mindset, keeps people from keeps us from saving people from heart attack and stroke. It keeps us from potentially preventing dementia. And I want to keep coming back to COVID. Stops early treatment.
Well, let's come back and talk about all of this on the other side of the break. You are listening to a special live broadcast from the studios of Startup Nation in downtown Birmingham. If you have a specific question on the subject we're discussing tonight and you would like to talk to the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR. Okay, we're on Facebook Live.
Yeah, we do have one question.
All right.
Melanie says, does Dr. K take clients who are long distance, not in his area?
That's Melanie that was in Korea. She's in Florida now.
Right. No, I do. I actually have patients that are all over the country. I've got a couple patients that are out of the country.
Right.
So, it is always nice to see somebody in person once, lay hands on people. But yeah, I have patients that live out of state.
So you're answering her, sending her a text message back to let her know?
Yeah.
Are
That
we at
is
the last
one-
segment?
Yeah, we're at the last segment. That is one thing, even though Anne Marie, you've, we're not in favor of telemedicine, but if you have the time and a relationship built up with people, then telemedicine has been great because
That's a little bit different,
Right.
though. I mean, it has its place. It's not like these practices that have switched over to it entirely. That's criminal. And by the way, just to let you know, this whole propaganda about, Canada's bad and Britain is bad because you have to wait, that's all propaganda. That's not true. Because we've got lots of cases where people got treatment, they got surgery, they got treatment in London and in Toronto and Quebec just as fast as they would get it here. See, that's American propaganda. I hate to tell you that.
And I'm not saying that it doesn't happen, and sometimes it's probably good, and sometimes it's bad. Same as here. But we've had callers who say I've had to come to the United States for treatment because I can't get what I need in the Canadian health system. It's nothing's all good and nothing's all bad, but in terms of prevention, this place is all bad. There's no effort.
Well, it's
prevention.
not that it's all bad because the unfortunate thing is you have what it takes to engage in prevention. It's just that nobody knows about it.
That's bad.
I know, I understand that's bad, but imagine the fact that you have the technology, you have all the the diagnostic tests that you've been talking about forever, and just nobody even knows what the tests are, where to get them, or what to do with them. And let's say, look at the number of people that go and get the CT cardiac calcium scoring test, and then they have the score, and then they go, okay, what do we do with this?
Well, that's why it's all bad, because having the tech or having the information without having someone to tell you what to do is as good as not having it. It's really as good as not having it. Getting a lab that's helpful and not being able to do anything with it. You know, I've been speaking to some vendors investigating some of the labs that I want to have in my practice and other businesses. And one of the labs that I'm interested in, they've slowed down their utilization of it because the doctors who are ordering it don't know what to do with the result, and it's causing problems.
Mm-hmm.
And that's the issue. We're holding off progress on innovation because the doctor doesn't know what to do. And it's about not having the time to spend with people to shepherd them.
Well, maybe the doctors ought to take a nosedive and find out what they ought to be doing.
Well, this comes back to doctors need to leave the system.
We do have a caller, by the way.
Okay.
Well, welcome back to the final segment of our special live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources that are available to prevent and treat the chronic and debilitating diseases of our time. We are broadcasting from Birmingham, Michigan, and you are listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Olivia, you have a caller?
Yes, we do. We have Marie on the line from Chesterfield. Marie, what is your question?
Last 2 years. And a year ago, my cholesterol was 161 and now it's 191, even though I've lost weight. And I don't know what I should do other than diet to change that, because I have lost weight and I do eat healthy.
Well, thanks for calling. And I hate to tell you this, but I don't care about your weight and I don't care about your cholesterol. Neither of those data points mean anything to me for prevention. The cholesterol is worthless, and you can be healthy at any weight you want to be as long as you're doing the things that I would tell you to do based on the results we find. So those data I mean, I know you want to be thinner, everyone does, and they want to be leaner and they want to be more in shape, but I'm going to say that weight just doesn't matter. Yes, we need to build lean muscle and we do need to lose a little body fat, and we want to trend in that direction over time, but I don't care what your weight is as long as you're trending. So, and cholesterol, it has no bearing on risk for events. So I don't practice weight loss and I don't care about cholesterol as a data point. So we practice prevention where we stop heart attack and strokes, and weight is irrelevant.
So then would the next step be medication, or how do you prevent stroke and heart attack that's not diet and exercise?
You've got to find out where you are. You got to get a CT calcium score to see if you have plaque. You have to get a carotid intima media thickness test to identify the layers of your artery which predict risk. You need blood work that measures inflammation markers that predict risk. And then you've got to find all of the drivers. Again, find out where you are. You may not have any plaque. And if you do, you've got to find all the drivers of disease that may or may not be causing symptoms that are contributing to your artery health. And it's a process, and it's a lot of work, and it's a lot of time, and you need to find somebody who's going to walk you through that process.
This is what
they will do this without symptoms.
That's the most important point, is that screening is how you prevent disease. You don't wait for symptoms, you waited too long. Doesn't mean you can't stop it, but you want to identify problems before they're problems. That means I want to find subclinical disease, subclinical plaque. I want to find insulin resistance before your blood sugar goes up. I want to identify people with sleep apnea who, before they develop atrial fibrillation, or have a stroke.
Okay.
So that waiting is the wrong thing. You got to, wherever you are in life, start looking and start the process. It does not matter where you are. If you're 30 years old, it's not too early. If you're 100 years old, it's not too late if you want to live.
Yeah, and Marie, thank you for calling. And also, you might want to listen in on Sunday at 3 o'clock. Dr. Kolender has a weekly recorded show where he's actually going to be talking about insulin resistance and some of the testing that he does. It is a pre-recorded show, but it's every Sunday at 3 o'clock, and we encourage all of the listeners to tune in and listen to the Sunday show. Dr. Kolender, what else do you have to tell the listeners about what they need to know about getting on board with taking the responsibility to find out what tests they need to know about and find out about? I mean, it's like a needle in a haystack.
Well, I think, this Marie was a great caller because it just pointed out the things that people in the front of their mind are worried about actually don't matter at all. And this is
Right.
our system telling you what to do. That's
Right.
wrong. And it's not her fault. She's doing what she thinks is okay based on every single message she gets between her doctor, her friends, the television, ads. All these messages tell her she should be way less and have a good cholesterol. And none of that matters. There's a lot of other things that we think are important that don't matter. I don't think hemoglobin A1C, which you see all these commercials about diabetic drugs. Oh, my A1C was this, my A1C was that. I don't think I care. As long as you're watching the markers that make a difference, which is what are your arteries doing? That's what we are treating. You're not taking a drug to lower your A1C as the end game or to get a good cholesterol as the end game. No, the end game is that you live to be however old you want to be and that you're climbing a mountain at that age, doing whatever you want to do at that point in life, and then you die. That's the goal, is to be living the best life until you die.
But I'm wondering where this myth first started, because you hear this a lot in America. And I'm, going back to the earlier caller who, I forget what her name was, from Birmingham, that called in and said, oh, if only everybody would just, diet and exercise, all of the problems would go away. I would like to know, where did this myth first start? Because doctors didn't propagate this. Doctors are not saying it, but there's this myth that, oh, everything is answerable by losing weight and being in shape and running and exercising and going to the gym. And guess what? And you're the one that can talk about this, because you have people working for you that are thin, exercise, and they have high plaque, and they had high results on their testing.
I'm glad you brought this up again, because this is a lady calling from Birmingham, Michigan.
Right.
Okay. The rest of the world, not living in, the whatever you want to call Birmingham, they don't have access to gyms and
Right.
healthy food
Right.
and education.
But that doesn't eradicate the disease anyway. It doesn't
Right.
matter.
Right.
But I'm asking you, my
It's
question to you
you
is,
know,
where did this myth first start? That if you are thin, if you are exercising, if you're quote unquote eating healthy food, whatever that is
Am I
is
getting
that
bleeped if I say
you
white
get
privilege?
you get, yeah, it's white privilege. But I mean,
Right.
I'm just asking, where did this myth first start?
It's marketing.
Marketing by whom?
People that make money off of you losing weight. I mean, weight loss is a huge business.
But okay, we've already had this discussion many times on the radio about the fact that the healthiest of people are dropping dead on their nose of the widowmaker. They're dying. They're getting disease. They're getting cancer. They're getting all the deadly diseases. They're getting diabetes. And I've got to leave the close to you because it's your show. But I mean, I just would love to know where this myth came from and how we can eradicate it. She was in Birmingham. God help the rest of
Right.
the people here.
Well, but you don't know her health. Just
No, but
because
it's
she
the
thinks
myth.
she's
The
right, it's a
problem
myth.
is she
It's-
swallowed a myth, and
Right,
we
but
who
it's-
started the myth.
It's marketing. and it's TV and putting thin people on television, putting thin people in ads, watching thin people eat garbage and being happy. And, it sends a message that, hey, I can do whatever I want,
As
eat
long as
whatever I
I'm thin.
want, as long as I'm thin.
Yeah,
It's
and-
all subliminal.
And they all drop dead.
They're all marketing geniuses. This is all subliminal marketing and messaging, telling you this is what you got to look like. And if you just
But
had,
that's no guarantee. That's
No,
not going to
it is
save you
not.
from disease. Well, unfortunately, we're out of time. So I'd like to quickly thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, Anne-Marie Cronin. We hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Please continue to tune into our shows for the latest medical updates. And thanks for listening to News Talk 760 WJR. Good night and be well.
My favorite part of the show.
Not those of Cumulus Media.
Will be soon.
Danielle was like, after you said
Who's
yes,
Danielle?
one of the people on Facebook Live that commented, she was like,
What?
after you answered the question about do you take clients like out of the area or whatever, she was like, definitely tempting on making an appointment right now